So still good morning. So interesting in the morning what we heard is how system and the processes helps in developing research mindset. If you devote to the system and processes, I was just reflecting back that why do LDD sir, MLD sir, KNK sir went on thinking all these and went into so much of abstract? Were they only clinicians? And whatever literature we find, is there a continuity? Is there a major expansion, abstraction, and do we, in the process, has got ability to research and understand that writing? So the presentation goes to, interestingly, I went again to general analysis and I told sir कि आपने मेरे को 40 मिनट दिया है, लेकिन मेरे को लगता है जनरल एनालिसिस पे 2 घंटा बोल सकते हैं. The amount of concepts and integration only the introduction part has needs a lot of reflection. Have we ever thought, सर ने हमको बोगर का टोटालिटी दिया कि ऐसे होगा? Did we ever question why, where, how? Was it based on certain scientific evidences? Was it validated any time? Or it is just we accepted कि ये बोगर का totality है? Same thing like what happened to Boenninghausen, right? Similarly, we accepted it, that sir has abstracted. So that is another question. Pathological general as a concept, you won't find anywhere else. The introduction is only in general analysis. You go back to all masters. I know I am open to get another reference of pathological general as an entity. It is not there. As far as I have done, if you have, I am ready to accept it. And how does a current advancement in a current world make Boger relevant for our day-to-day practice and operations? And the most important concept of SFFT, I know people who are in a regular or have heard our concepts, structure, form, function and time. It's not concept applicable to homeopathy, but it's a concept applicable to universe. Just need to look at, and the level of abstraction which we find in perceiving, you need KMD sir to explain it. It's worth listening and worth sitting down and reflecting that at what level of abstract philosophy and application can be integrated in day-to-day practice. And that is the hallmark of MLD sir. I've told sir that I will be the biggest defaulter as far as time is concerned. So I've already informed him. I'm not going to expand too much on these background studies. I'm just going to give you some reflections of whatever they have written. Interesting, when you read this sentence, pathological generals are not diagnosis. They are pathological condition. Let's understand the concept. Most of the time, we write a diagnosis. And the same thing happens when we put in CI of our SCR, of functional phase, structural phase, we write diagnosis. That's the place which is meant for pathological conditions and the state of pathology and not diagnosis. The next important sentence is, this reflects the tendency of a system. It does not reflect the pathogenesis alone. I mean, it goes beyond the state of pathogenesis, but it is generalized as a tendency of a system. Why I break it? Of whole constitution or lifetime effect. See, this level of abstraction and understanding the individual disease and the pattern. And most important is, now if we connect all these three, we understand how constitution responds to certain input, create a pathological condition in that specific organ, is individualistic to that man. Now this is a foundation. The concept of totality which you find in general analysis is, there are threefold. I'll put all three together. This is a fundamental constitution as an entering point. Current complaint is the second thing, and third is modalities. Now Boger says, to pick up the central one is a difficult task. And when you go back to pick up everything, like Chetana shared, is a cumbersome, laborious, and impractical. Now these are all words of general analysis introduction. So then what is an alternative? Now please pay attention to that this is a part which is there in general analysis, and how does it travel to symposium volume in a structured directions. So everything started with Boger, with LDD sir, and how it went on refining. So how did it travel to when you go to the symposium volume? I just want to share rest of the things. I think tissue affinity and pathological generals are common. The concept of time as we understand is very restricted. We just talk about onset, duration, progress, maybe periodic or maybe alternating effects or acute exacerbations. Now here the time dimension is they are all part of our ET, right? And all of them, they form a time. How do we comprehend this and bring them into our totality? I'll also share some different concepts. Wait. So what is the meaning of tissue affinity? This is all part of symposium volume. This we have already discussed. One thing which I also want to share, that please read concept of time because it has got different dimensions, causation as a time, concomitant as a time, and how to, now what Dr. Dhaval has discussed about the time, direct correlation with chief complaint, both existing together as a chief and associated complaint, the physical general as a concomitant which is developing with constitution, they are all expressions of time. And how do you relate them to totality becomes an important, because then we will unfold Boger from that perspective. And you will not wonder why LDT sir and MLD sir got so much attracted to Boger. This is Boger's sentence. Analysis to synthesis. Clinical foundation and experiences are the base. He advocated doctrine of generalization, pathogenesis. I don't know how many of you have read BSK's Introduction to Materia Medica. And that is the only place where he has used word as a physiological reason. When we understand reason, our concept is it is anatomy. And when we go to the Boger synoptic key as a reason, you find digestion, you find circulation, you find nutrition, you find metabolism. How come they become a part of sphere of action? So his concept was not centered on anatomical sphere alone, but the physiological processes, where the anatomical organ was not enough to explain the whole pathophysiology. Proving and reproving. BBCR introduction. What is important in BBCR introduction is seat of disease. Since we are unfolding Boger's concept, how it came into symposium volume, these were the references. And the concept is more important, as whole body seldom gets affected. What does it mean? Why the organ is so important part of the individual constitution. He gave interesting examples. Since I don't want to get into too much of and too many examples, he said sepia cures local abscess of finger and toes, which are fatal abscesses. But the next sentence is, if these fatal abscesses are any other place, sepia will not be indicated. So specific location, which becomes so important. There are few more examples which are there. So it is the seat where the pathology is. The pathogenesis you can generalize, but organ-specific explanations are so important. Few of his literature which I have explored, I have gone through almost complete literature of Boger as much as possible. In the proving symptoms, now you will understand how he has generalized clinically. When he talks of dysmenorrhea, he talks of genitocrural nerve. I mean, how many times we have thought of dysmenorrhea and nerve? So when we look at McFoss, the nerve and the muscle and the spasm, no, it makes a totality. Same way, these are the proving symptoms of xanthosylum. Clinically, these eye symptoms of congestion, burning, heaviness, pain, grinding sore, vision, bright blue, black flashes, he generalized it into ophthalmi. One sentence, done. These are the way in which he went on making general pathogenesis and generalities, which has got clinical implications as well as practice implications. Two more examples. And we are talking of 1898. He says, belladonna, the common modality is headache worse by lying down, keeping it low. An interesting way of explanation, there is an inflammation. He says that belladonna group of remedies, Solanaceae, have got congestion. So when you lie down, the blood rushes to the head, the capillaries get involved, the heart starts beating more, the transmission of pulse goes and it gets transmitted. Now you look at the belladonna totality, and he says since there is a rush of a blood to head, the lying low is a eventual modality. And when we compare his China, he says there is no inflammation. Even in malaria, all the symptoms are because of suboxidation of blood due to loss of blood. The toxins which gets produced, they produce the hypersensitivity as well as the local reaction. Now this all explains his thought processes, that at that time when he thinks inflammation versus suboxidation, which we are still not in a process of trying to find the sphere of action and pathogenesis of the remedy. The next example, he says why hypericum is so important for tetanus, because it is oxygenated oil which produce an environment because of which bacilli die, and that is why it is a good remedy for tetanus. Interesting. He says that we cannot prove Vipera hemamelis, we have not proved in advanced pathology, but they are indicated. Now these all needs further exploration. So he was work in progress. So we will understand how the generalization of pathology connecting with the indication of remedy, modalities. Individual remedies, he has concentrated location and site, pathogenesis, modalities, and modalities, time, very, very important, time and epochs. This is all when he describes lachesis. And when you read the lachesis, you understand the concepts on which he has built his Materia Medica. Suppressive causations. And multiple places he has used comparative Materia Medica as the lesson to be taken back. I think this is one of the most important example how Boger's mind work. He describes the case of a patient with chronic headache and edema. He gave glonine. There was a partial improvement. And he realized that glonine is a nitrate, which has got impact on a pulse. But patient didn't improve. So he saw urine report of a patient which has got albumin. The patient had an habit of chewing clove. So he attributed it to it, but body shown the albumin. And then urine had chloride and calcium oxalate. So he said, this is digestive system which is exhibiting through urine, the urinary system. When you go back and read strontium, these are the indicated locations along with the congestive pathology because of the pulse. And then nerve, nitrate, vasomotor, craving clove is an odd thing. So nitric acid synthesized it and gave strontium nitrate, and patient improved. Now this is how mind works. You know, we attribute in today's, and whatever available, including investigations, how one makes advantage of it, connect with pathology, pathogenesis, location, and built up from the experience of the case, the simillimum. I think one of the most important contribution is, we talk of predisposition, disposition, diathesis, disease, right? Boger says, please examine. Majority of patients usually suffer and have hereditary influences directly from parents is 50%. 25% influenced by grandparents. And 25% influenced by other descendant. Interesting. And this talks of predisposition and how, as a disposition, I connect. You know, everywhere you can see the stamp of Boger in whatever methods and then you have to work out the individual organs, pathogenesis affected, take them into your totality. And he gave example of one patient where if you do the direct repertorization, pulsatilla will never come. He went into the history, past history, he brought out the type of diseases, he repertorized, he got pulsatilla, gave it to the patient, and patient became all right. The most important, now you can read, amplification of hereditary influences. So you can see the concept and philosophy on which the Boger has built the whole of his repertory and materia medica. See, these are the expressions of time: rapidity and quick evolution, rapid acting remedies but disintegrate the organ, like crotellus and sulfuric acid. You can understand the time, pathogenesis, and the end result. Disintegrate the organ. Now you look at slow and deep acting. Deep acting remedies which help in tissue building and impact cell actions are antisoric. You know, it's a beautiful description of miasm in a remedy. But sometimes can be indicated in acute also. So, same article on strontium, he says, question is not what organ is affected, now this is another concept, but what phase of disease is exhibited, concept of time, the pathogenesis, by combined effect of organ. So, like strontium case, it was urinary and digestion together was strontium, not urinary alone or digestion alone. That would have given you the different group of remedies. But the combination of both reduces the number of remedies which gets eliminated. That's an important concept. Pathogenesis, a corresponding combination of affected organs, is the first thing in his totality, which there remains the modality. If you are able to reduce the number of remedies just by putting up a combination of affected organs, then put the modality to the next, the major step towards simillimum is done. It's not I am saying, and this is an experience. And he gives the example, interesting example. Depends upon what organ was affected. If she had cancer of uterus, I would look up under uterus. Wait. The next example will give you the real insight. If the infection is in the leg, it is in the muscular part of the leg, it is a muscular system. Look up in the muscles, not the leg. All action becomes simplified as they approach perfection. So if you devote to system, gradually work on the system, the action will be simplified. And that is how he tried to find a system and approach which is simple, which is objective, which is straight. Not based on the mind and abstraction of mind. And if you really want to understand the abstraction of mind, you can go to General Analysis Introduction and read how mind is abstracted. Why SFFT? Now, I have already said you need organ, combined organ, you need pathogenesis, its evolution, right? You need altered physiology, the function, need the expressions and the time. There is no other tool than SFFT which will give you everything. So seat of the disease in terms of anatomical sphere and evolution with time in pathogenesis, change in physiological function and reason with time with pathogenesis. These are the concepts which he used in writing Materia Medica. Expression of time, including cause and concomitant, expression of sensation and complaint, the time in all its dimension. So working on all this background and the concept of reason, the physiological reason was picked up for the study. Through current advancement in clinico-pathological understanding of the diseases, and this tool was most appropriate to expand and to understand the Boger's concept of reason. And there are two very important parts. The supplemental reference table in BSK is a ongoing work which stopped with Boger. But when you look at, how many of you know old learners who had gone to Girgam, OPD or Chembur, there is a BSK with blank page interview. And on that, you will find MLD sir has entered through his handwriting. That was the work in progress, which probably stopped there. Now is the time to relook at it. So we took up PhD projects. One is reason, another is generality, and third is mental state. Probably I have completed with keeping reason section, exploration and additions with verifications. Two are under process, and probably today's presentation will encourage them to speed up their processes. So literature, the methodology for PhD literature search was done and review was done, as I have shared few of the examples. Standard guidelines were set up. Clinical cases of 10 polycrest remedy, 15 each were taken. SFFT of complaints were prepared. They were put to checklist. Analysis of checklist were done and observations were noted. Synthesis were done based on Boger's concept. Findings were compared with BSK reason and section. And then verification, specification and additions were done. The purpose was not to rewrite or redo things. Purpose primarily was to let down the process so that each one of us can work through this process and start updating BSK for use of the homeopathic fraternity. I'll just show you some example of the work. So these were the cases because I had to define the variables. So these all details were taken, and we'll see that there is no single, oh God. So this is a detail of the patients because we wanted a sample with, we wanted a sample with less of variables. So, we tried to connect the samples with the demography, marriage, age, education, occupation, caste, so that, you don't find a single cluster in which you find patterns. So we wanted, that's why this was taken up. The age distribution, education, demographic findings were noted. These were the diagnostic distributions. Then system distributions. Then sphere of action, which are affected in natrum carb. Then types of tissue affected. Then function altered. Then pathologies. And these were the observations. I'll just take that back to the things. In this, A means addition to current BSK. V means verifications. And S means specifications. Out of 15 cases, whatever was derived. So, the original BSK only has got nerves as a tissue, but smooth muscles, blood vessels, skeletal muscles, cartilages, mucous membrane, and glands. The organ system digestion was verified. The skin was verified. Hands, dorsi, and heels were not good, but we have generalized it to musculoskeletal system. Joint was an addition. GIT upper and lower. I mean, I was surprised not to have GIT in that terms. Probably Boger has generalized in terms of digestion, both upper and lower, in terms of organ system. Degeneration as a pathology was a new finding. Otherwise, inflammation, ulceration, they can be connected with GIT, but it's not there in a BSK Mathemedica. The general state of exhausted, relaxed, puffy, weakness, hypersensitive to external stimuli and dietics, they were not seen at that level, but they are there because they are connected with digestion somewhere. This is MLD sir's. And I'm glad I got the gland as an addition, and there is a gland here already appearing. So this is the work in progress. This is the legacy in which we have to now work on. So these are the conclusions of natrum carb. So what is the learning out of the whole process? Boger integrated all the approaches and defined each component of totality and its individualization. What is important is, he has not worked alone on organ or pathogenesis. he gave definition to all components of totality. And he tried to characterize, gave the operational way in which they can be used for coming to simillimum. Extended meaning of generals. Just extended from Boenninghausen. This is a very important concept of physiological reason. Probably we are not using in our day-to-day practice, where we get carried away. So when you generalize, a lot of these concepts are useful in totality. Now it's up to us, how do we take this forward? And when I sat back and I reflected the whole of our ICR system, the different tools, how do they excite or instigate your inner inquiries? Because whatever you attempt, it's going to ask you questions. And if you try and attempt to solve, it gives you reason to explore. So each of tool, if you follow the system, as a practitioner, this also is very useful to develop research mindset. Because for homeopathy and for homeopathy, each case in it is a research. So if you develop this mindset, and this is only possible, that's why from morning we are seeing the SFFT tool, the repertorizations concept and approach, and here SFFT tool. Now they are so inherent and foundations which will guide us for our PhD work. So thank you all.
Yeah, we are doing one after the other.